You very fairly pointed out a difference of emphasis between your own view and the WHO guidance on masks in particular. But returning to your own view, you said that it was particularly important for service providers and transport workers to be protected. Is it more important that they wear masks or that the general public wear masks, or is that a false dichotomy?
Well, actually, I was thinking about, when you asked it before a bit, I was wondering, you know, obviously, if I am a bus driver, my real risk comes from other people in my bus, particularly if it's crowded, being close to where I'm driving and coughing close to me. And we know that face protection is quite useful for preventing somebody who's got illness from passing it to others. And if people are not responsible and staying at home when they're ill, or if they're just in the process of becoming ill with COVID, then it's a decent thing to do to wear a mask to protect the person who's serving you. So that is my fundamental point on this. And I think I want to go on saying that again and again and again, because I don't think it's fully understood. I was saying to a colleague the other day, if they're going to open restaurants in France and have people indoors, then the diners ought to be wearing masks to protect the waiters. And my friend said, no way that will ever happen. But I said, from a logical point of view of being responsible, it's the people who serve us who we need to protect. So I hope I don't think it's a moot point. I think it really is about respect for those who serve us, who often have no choice but to do the work because they're poor and they've suffered huge income losses due to lockdowns and so on. And so it's part of being, I think, really responsible.
Thank you. Just one other question, and that's with regard again, and I don't wish to point out differences of view between your own personal view and the WHO guidance, but there's considerations for public health and social measures in the workplace, WHO guidance of the 10th of May of this year, and they say that physical distancing at least 1 metre apart for workstations, common spaces, and where congregation or queuing of employees or visitors might occur. Now, you have said 2 metres is safer, 4 metres is safer again. Could I ask then, why does the WHO say at least 1 metre rather than at least 2 or at least 4, or no congregations indoors?
I think in all the advice that comes from an organisation like WHO, they really do have to offer the best information on which others can then make decisions. Remember that the WHO is not an enforcement agency. I think on this one, they have worked really hard to recognise that for the majority of people in our world, particularly in poor places, the thought of living with 2 metres distancing is just completely out of the question. And if they did have that as part of their guidance, they would be accused of being completely out of touch and they would have been ridiculed. That was my understanding of it. But there is one other thing that I discussed this morning with Dr Ryan, which he felt that I ought to get across. He reminded me that there's a huge difference between being with somebody who's got the COVID for, say, 4 or 5 hours while they're coughing and before they manage to get home and isolate themselves, or being with somebody who's got COVID for 5 minutes. You are so much more likely to get infected if there's a long period of exposure. And so I think that both Mike and I would like to share with you all that if you're going to see a reduction in the distance to 1 metre, just bear in mind that if there is a prolonged exposure at these shorter distances, that really does greatly increase the risk. So there is, I think, a need to once again look at things like workplaces and say that perhaps in a place of work where people are spending more time together, then a slightly greater distance makes sense. I hope that's clear, and I hope you don't mind me trying to put it in a bit more into context, because in actual practice, over time, it won't be authorities that tell us how close we're going to be able to be to each other. It's going to be we ourselves who have to make the choices in our workplaces, in our social lives, in our families. And I think you've heard whenever I've been speaking or in my media work, I am trying to all the time help people have whatever information I've got so that they're enabled to make their own judgments.
Thank you.
But in the end, it'll be up to all of us how we deal with this threat.
Is cancer screening a very dangerous procedure for healthcare providers to engage in, such that would justify the suspension of all cancer screening activity for months on end in a country like Ireland where PPE is available?
So one of the things that I've noticed is that the reaction of healthcare providers at the beginning, when they're starting to deal with COVID, has been quite absolutist, and quite a lot of procedures which might be called routine, though I would not say screening for cancer is routine, have been suspended. Even in some places, maternity support services like antenatal care have been suspended. I'm not talking about Ireland, I'm talking about more generally. Then over time, as the professionals have got their routines sorted out, have changed their patterns of flow in the hospital, have got adequate PPE, have managed to get their shift times right, have dealt with also any possible accidental infection that might occur for those who are providing support services like porters and cleaners, then it's become possible for them to adapt and readjust. And I think there'll be more and more of this happening. So whilst there might have been, in some settings, a cessation of screening procedures and even treatment procedures for people with chronic diseases that require ongoing attention, after, say, a month or two, things have settled down and new systems have been developed. So I would expect, in places where cancer screening has been stopped, that over time, and it'd be quite quickly, that there will be a sorting out. Just as in schools, there's a lot of questioning about what to do about schools and a lot of uncertainty. And I would expect that gradually as we get into this, the procedures will be established and things will get better. And anyway, we'll be informed by more science. So in answer to your question, I don't want to be absolute. I want to say it will come good. It'll just take a little bit of time.
Just in response to my last question, you said that you expect to see schools and education facilities opening quickly. Do you expect that the 2 metre distancing will be maintained in schools and that will be respected, or that will be the norm across Europe and the developed world?
Well, that's me looking into the future. I mean, most importantly, I think that when it comes to schools, we need to be doing everything for the adults who congregate at a school place, whether they're teachers or parents or anybody else, because that's where I think the major potential for spread is going to happen. Secondly, obviously, it is necessary to try to ensure the best possible education experience for children. I'm one of those people who's been distressed by the number of months that children have lost for their education at all ages. Will it be 2 metres or 1 metre in school? Well, between the children, I understand that the approach is one of bubbles, and I think that that's a very promising one, and I expect that to remain. But I suspect that for the teachers and for the parents, the rule in schools will be the same as the rule everywhere else. And if there is a decision to try to move from 2 metres to 1 metre for any reason at all, then I'm sure that will take place in the schools as well. But I just encourage everybody, because this is my last word, just please stick with the basic principle that it's a comprehensive package of interventions that we have to use to keep the threat low. And if there is going to be a decision to get it down to 0, then that comprehensive package has to be super strong and maintained for a long time, and it will include also action at borders, because that's the only way you can keep it at 0. If there's going to be a willingness to tolerate it, there will be some cases appearing, but they'll be dealt with very quickly at local level by well-organised local authorities, coordinated with others. Then that will become the norm, and there will be odd cases, but they'll be managed very, very fast. But I would like to just really ensure that whatever standards are adopted, they are adopted wholeheartedly across the country. And then if there is a need for adaptation because of a local flare-up, that everybody understands why that is happening, using the kind of indicators that I know the government is looking at.
Thank you very much, Dr. Nabarro.
I hope this was some help.